All right, folks, here we go. So, 5, 4, 3, 2, and 1. All right, folks, welcome back to the podcast. Very excited to have as my guests today, Timothy Doc Royer and Amy Royer. Folks, welcome to the podcast.
Thank you.
We're really excited to be with you today, Guy.
All right, appreciate it. So Dr. Timothy Royer is a clinical neuropsychologist, and Amy Royer, RN, is a registered nurse. Together, they are founders of Royer Neuroscience. Dr. Royer is also co-founder of Inner Armor, and they both have dedicated over 35 years to helping individuals reach their potential. With a deep passion for understanding the human body, both Tim and Amy believe that, quote, "we are all fearfully and wonderfully made," and their work is a reflection of this conviction. Their recent book is called Tsunami, Building Resilience Against Anxiety and Depression. Folks, welcome to the podcast.
Yeah, it's good to be here.
Awesome. All right, so before we get going here, I want to ask both of you kind of separately where you're from originally and where you are currently.
Like historically?
Like
going way back?
No, just like where were you born? Where are you from originally?
Hey,
Amy, you go.
You want to go first? Go ahead.
You'd think that could be a simple question, but
Right.
I grew up on a mission field where my parents were missionaries. So that's a rather unusual part of my background, but have been back in the United States since middle school, met Tim at college, then we both began our practices in Atlanta area. I was a nurse at a children's hospital. And then we moved to Michigan, raised our kids there for 26 years.
Wow.
Then we started hunting for some sunnier, warmer climates. And we live in Charlotte now, Charlotte, North Carolina. And it's sunny and lovely.
Yes.
Nice.
Definitely. And
right.
my past is I was born in Concord, Massachusetts. My father was a college football coach. So he and my mom, the first 12 years of marriage, moved 13 times. So all up and down the East Coast. And as a kid, I can remember moving down to Annapolis, to the Naval Academy, to Virginia Tech. He passed away when I was about 7, and we settled in Tampa, Florida. And I grew up in Tampa, went to college in Ohio where I met Amy, and then our trip to Atlanta where we did all the graduate work, and Amy at the Children's Hospital. And then, like Amy said, Michigan, and now here in Charlotte.
So, okay, how does this start for you both? I mean, founding Inner Armor, neuroscience. You both have this energy. Together, you have this energy.
Yeah,
it's palpable, and I'm not surprised given what you guys are doing. But how did this interest start for you? Let's start there if we can.
Yeah, I think for me, I was just going through the paces of education. You know, I got out with a bachelor's degree in psychology, which you really can't do anything with. Went off and got a master's degree in clinical counseling, and realized I wasn't going to do much with that. Along the same time, I do have an interest in kind of faith-based things, so I got a degree in a master's in theology. Then went on and got another master's in clinical psych, and that's where I really got drawn into testing. Neuropsych testing, personality testing. I really am a data guy, and so that I was really drawn into that. And then I ended up doing my doctoral work in neuropsychology. So that journey then led us to Michigan to do a year of a doctoral internship. And through that experience, I had an unbelievable opportunity to start a consultation service at a large children's hospital, where I actually became division chief of behavioral medicine. I mean, like the dream job. It was perfect. I loved it. It was so cool. And was working, right next to all these fantastic physicians and surgeons, and helping them understand with these children the psychological overlay, and really using my testing skills to define what was really going on with these kids neurologically and psychologically, because so much in medicine in kids has a psychological overlap. And so helping these doctors decide what was going on through various testing, or if somebody had a brain tumor, assessing the brain before they took out the tumor or treated the tumor. It's fascinating. I loved it. Did a lot of work on the ICU to help figure out what diagnoses were going on when somebody came in, maybe in a psychotic episode. But what started happening was I just started to see more and more kind of behind the curtain on these kids that were getting overdiagnosed with things that when we would actually test them, they didn't even have these things. And the big one was ADHD. I mean, we had about 60 to 70% of these kids that we would see them kind of in this crisis state and find out they don't have this diagnosis. They have something else. And then they were getting just flooded with medicine. So many times on the ICU, I would see kids on life support because somebody had gotten too aggressive with psychotropic meds. That's the dark side that nobody hears about. And that really, Amy was, at home working with, raising our 4 kids, but she was still, from her pediatric oncology background, she has a passion for kids. And we would just talk about this stuff, like, can you believe how misdiagnosed and how over-medicated? And what really pushed us out of kind of the traditional kind of dream job was, this isn't working. Like, this system is broken. It's just not getting us there. And it's about that time that Amy started to come into the scene with, when we started to go out and I started to develop. It wasn't Royer Neuroscience back then, but I needed some help. And with her medical and nursing background, then we started the other companies, right?
Yeah. It's funny because it probably all started long before we knew it was started, but just like way back when I worked in the hospital and Tim was in school, just my learning and understanding of the connection of the brain and the body in these kids that were acutely ill with cancer or blood disorders, but then having my own kids, having 4 different personalities and watching that and knowing what Tim was going to work and doing every day, and we would just talk about this kind of stuff. And so then when I got back into the workplace, I just joined him in what he was doing, and the combination of our years of experience to that point and then putting my profession with his profession was, they're not connecting the mind with the body. So that started everything moving forward, as far as we were willing to take a risk of leaving the dream job, so to speak, and starting something that, fit us both really beautifully, but it was a leap.
Yes, it was.
Let me just jump in here for a second. So in addition to, they weren't seeing the connection between the mind and the body. So what did you want to do? What was the initial goal here? We need to do what?
Yeah, and so what started happening, one was help physicians and school systems see what is going on upstream. That's a very common term that we use, is that everybody's looking downstream. They're looking at behaviors, which is good, and trying to alter those behaviors with chemicals or how you're thinking about something. But there's so much more complexity that real change happens upstream in the brain. And the big part of this is the autonomic nervous system. So I initially wanted to come alongside some of the behavioral therapy I was doing with some biofeedback measurements. And in the early 2000s, I needed something to measure biofeedback, so I went and got this device that measured skin temperature. So I would teach kids to breathe and then do the therapy with them. But I started to see that if I kept diving into these physiological measures, body temperature, skin conductance, breathing, heart rate variability, EEG feedback, hormones, sleep cycles, all of a sudden it was like, wait a minute, this is way more than just how I reframe my perspective of the world. Can I actually teach resilience physiologically that actually prevents these things coming on? Or if I'm in the middle of this, can we actually turn the tide on this? And what was really interesting was I was so inundated with my training and coming out of the Children's Hospital that I tried some of these feedback techniques, especially some EEG feedback or neurofeedback, with this group of ADHD kids I had. And I had some interns and had them track them and then teach them breathing and heart rate variability at the same point. So we were doing biofeedback and neurofeedback, and I was doing behavioral therapy. And I kind of compared the groups, right? We got to the end, and almost every one of the kids that had gone through the 8-week program were almost completely off their meds, and their parents were like, these kids are doing so much better. Oh and God. Here I am plugging along doing my behavioral therapy, which is good, and I'm not opposed to that, but I'm still banging my head against the wall. And I went back to the interns and said, you must have done something wrong. How are these neuropsych numbers looking so much better on these kids? I haven't even talked to them yet. You're just teaching them to breathe, to work on their heart and their brain. God. And before I knew it, within 2 years, I took a practice of a couple hundred kids, and I completely killed my practice of talk therapy because I started teaching all these people how to be resilient, and the parents would come back and like, he's making good decisions. I'm like, wait a minute, we haven't talked yet about how he needs to make good decisions. You're like, no, his nervous system is getting better and he's making good decisions. So that really kind of, we never intended to be there, but we started to see the power of the brain's greatest ability, which is to learn. And if you can teach it through the right types of feedback, if you can teach it physics, you can teach it to focus, right? Mm-hmm. And you can teach it how to be resilient and manage anxiety physiologically.
All right. So amazing. Really, it's amazing because I mean, I'm getting kind of chills because I was working with kids and just saw a lot of what you were seeing and just thinking to myself, and it's really why I started this podcast, like I need to do something to help move things along in a certain way. But you talked about upstream and downstream and resilience. What does it mean when you say resilient, teaching these kids to be resilient? What do you mean? Define that, if you will.
I can go on that. I think what we mean is with the autonomic nervous system that we have a spectrum of response that we would give in relation to the environment that we're in. So if we're in an environment where there's a fire, we want the sympathetic nervous system to take off and so we can run. If we are time to go to bed, we want the parasympathetic nervous system to take over and lead us into sleep. So what we found with a lot of the kids is that instead of being able to move along the spectrum, they're kind of stuck. We don't know exactly why they're stuck. And a lot of what his practice was to figure out why they're stuck, right? But what we found was we could train the autonomic nervous system with the neurofeedback and biofeedback, and kind of in the end, maybe it didn't matter so much why it was stuck because it was now moving. And it's so interesting because when he was speaking before about teaching the doctors or teaching the teachers, what we really have been doing is teaching the parents to recognize how to advocate for their own children and to understand the spectrum. So as we taught them to breathe and did some neurofeedback, their ability to slide along that spectrum between parasympathetic and sympathetic became wider. So they're not just stuck in a little lane, but they have a wider lane of response. But it also became more accurate so that they weren't stuck in fright-flight when there wasn't a reason to be in fright-flight. It was, we call it resilient, but we call it dynamic resilience because the response changes with the circumstance because it's never going to be static. So we also, at the same time, were raising our 4 kids. So we were running into these situations where the kids might have a poor response to a certain situation, and we want to enable them to have a better response. And that was when we learned, and we were getting into more of this, so we were watching our own kids grow in resilience. And so it was like, put those leads on me because I want it too.
So let's, for a second, we hear neurofeedback, we hear biofeedback. Just give us what is neurofeedback? How are you working with these kids? What are they doing?
Well, Doc will always say that the greatest thing about being a human is that we're always learning and we're always adapting. And it can be the worst thing about a human because sometimes we make poor adaptations in order to survive. So we're going to try to teach healthy adaptation. So when we do neurofeedback, what you would walk in the office and see was a child with a lead on their ear, a lead on their head, and a video screen in front of them. And the video screen will run when the brain is in a more calm and focused state. So when the kids would come in with ADHD or whatever the diagnosis was, the beauty is it doesn't matter what the diagnosis was because we're looking at the balance of brainwave activity. So Tim had a specific range that he was trying to meet with his neurofeedback training. And so that was kind of our protocol. But basically, it's to decrease the stress level and increase the medium speed waves where you can get into that calm and focused zone. And typically, then that will balance out the sympathetic and the parasympathetic response. So that's what neurofeedback would look like for us. We would describe it to our clients as like a giant sticker chart, like the biggest sticker chart you can ever imagine. And in your half-hour session, you're getting 2,000 stickers without even us having to make an effort. It's just the computer integration with the brain. And then the biofeedback, the breathing, that's real simple. It's, a screen that's showing you if you're following the breathing pacer. We moved into more things like temperature, increasing peripheral temperature as far as a relaxation marker, and then heart rate variability. But we would scale those screens back so that a kid could understand them.
And they're using devices connected to them. So breathing isn't just following the pacer, but we're putting a tension strap around the waist and making them breathe with their diaphragm in a particular pattern that will then activate coherence in the heart, which is what creates that resilience cardiovascularly, that expandability, that adaptability. And we're reading their heart through a heart rate sensor at the same point. And what we started to realize that initially neurofeedback hadn't done a lot for us, but when we started to combine oxygen flow and cardiovascular regulation, that it was like it created this perfect resonance of bringing these three things together. And basically what you're working with is what we all work with, which is feedback. We use watches for feedback. We use GPS for feedback. We use feedback with everything, and we adapt our behavior to that. But what we're doing is providing physiological feedback so you can see yourself on the screen. And the key to behavioral change is decreased latency. So if there's a delay, like if I do something, but I'm not rewarded for it for 10 minutes, like let's say I shoot a basketball, but I don't know if it went in the hoop for another 10 minutes, it's very hard for me to learn to shoot that basketball. And so this is why a lot of times some behavioral therapy will fall short because there's too much latency. This activity has fired in the brain, but it may take 10 seconds before you actually see that the child is not paying attention.
Right.
So what we're doing is we're meeting the behavior before it ever becomes a behavior by seeing the neurons right when they fire and the electrical current and adapting that and changing that through the reinforcement.
So a kid, for example, is having this experience and over time, ideally gaining certain mastery over their body, over their thoughts, their breathing, etc., and then able to take that into another experience.
Yeah, they're kind of learning to use a speedometer, like on a car to go a certain speed. And a great example is I had a kid recently that he was working on focus, right? And so we had the the EEG hooked up, and whenever the brain would get into focus, which is a certain electrical speed, around 12 to 16 hertz, that whenever the brain waves would drop into that speed, which all of us do, the question is how long do we stay in it? He'd drop into the speed, then he'd get reinforcement. So his favorite music video was playing every time his brain would drop into that. If he became more anxious and started worrying about something or thinking about the future, the video would stop instantaneously to the millisecond. If he started to get more distracted and his brain was going too slow, then the video would stop as well. So we're kind of honing him on this certain speed we want.
Right.
And for a few weeks, nothing was happening. And then all of a sudden, like I can hear from the other room, the music's playing. I'm like, what's going on in Johnny's room? And I walk in there, and he's like playing an air guitar to this song. And he's like, is this what you meant by focus? And I said, yes. And he says,
oh, man.
I didn't know focus was this. I thought focus was like grinding down on my teeth and, and he says, I can do this all day long. He's playing the air guitar. So I said, Johnny, next time you go in to take your test, I want you to pretend to play the air guitar.
Oh, wow.
He walks in holding an A+ in his hand.
Shut up.
Yeah, and he's like, Doc, this is easy. But think about these things these terms we use that we just assume I know what it means to be calm, or I know what it means to be focused or creative. Those are very abstract unless you can see it and experience it. Yeah.
So this is awesome. Okay, so let me just remind everyone here, I'm speaking with Dr. Timothy Royer and Amy Royer. She's a registered nurse. The book is called Tsunami, Building Resilience Against Anxiety and Depression. So having said all this, with all the diagnoses out there, what are you saying? What's your thesis?
I'll leave that for Doc.
What I'm saying, is first of all, we have to acknowledge there's a significant crisis going on. Okay. We are now at a point that 1 out of 5 people have clinical anxiety, not just stress, clinical anxiety. That's about 40 million people in the United States. Then we have another 20 million that have clinical depression, right? So, we have a family of 10, and that means, 3 or 4 are going to, experience something, right? This has been an astronomical increase in the last 30 years. We were promised in the late 80s, early 90s on the front page of Newsweek that Prozac would eradicate depression as we know it on the planet. That's what we were promised. And it's been exactly the opposite, with a 35% increase in this. And it's estimated in the next 20, 30 years that 70 to 80% of the population will be experiencing anxiety and depression. That's going to completely bankrupt our economy as we know it, okay? So first of all, there's a real problem. Second is we don't really have enough adequate resources. If you do the math just on psychiatrists and social workers and psychologists, you can't even come close to it. Of the clinical people, there's only about 27% that are actually getting services for their problems. So we couldn't even match that. And we work in a lot of universities where we use these kiosks that students can come to and learn these things in 8-minute sessions, and they do that a few times a week. These universities, they're dying because so many of these kids are dropping out because of anxiety and depression, and they're trying to build more counseling centers, but that's not going to answer the problem here because it's more upstream in the brain and body. And so what we're proposing is anxiety and depression isn't just about the people that are currently suffering anxiety and depression. Anxiety and depression is about me, Doc, Amy, Guy, all of us building resilience so that we can manage those storms and see those stressors as something that actually make us stronger, right? And that goes back to shoring up the autonomic nervous system. We have a project starting next week at a school in California. We work in a lot of schools and universities. But we're going to be hooking up 75 third graders to breathing belts. And during their school day, every day, they're going to be practicing diaphragmatic breathing for 7 minutes. And we've done this in other school systems where we've seen reduction in depression and anxiety by 70, 80% in these little kids, right? And I can just see this picture of these 75 kids all doing their breathing. And everybody's like, what are you doing? We're building resilience so that 10 years from now, 20 years from now, 30 years from now, these kids have a strong autonomic nervous system. And so Tsunami is all about, the thesis is this is about all of us. And we have to be building resilience early on. The answer is not just counseling and more meds. We are not opposed to those things, and we're very thankful for them, but they're not answering our dilemma, our epidemic. And we have to come about it another way, which is building resilience in the autonomic nervous system.
And you don't think that, or to what degree do you think that talk therapy, CBT, all those, name any other modality, to what degree do you think they are effective, they are helping?
Yeah, I think that's did you want to jump in?
No, I would say
Okay.
that we do have a chapter in the book where we talk about the value of those things, and that we wouldn't want to be quoted as, discouraging people from seeking those things out. We do talk about the supply and demand just being completely inadequate, and also insurance coverage difficult to manage. So we find them definitely effective, but the funny story is that when Doc was running his clients through the neurofeedback and the biofeedback training, he didn't really need to talk to them as much anymore, because
Right.
their brains were solving their own problems. And this was going with kids initially, but then adults, because their parents were like, I want to do this program too. So where we had set up our office to be pediatric, we had toys in the waiting room and stuff. Now we started having all these parents. We had to get bigger chairs to accommodate adults. And so just kind of funny how we ended up in that space. But then adults, when you start talking with adults, they're going to start using the words anxiety, depression, OCD about their own self. When it's the kids, it's attention deficit disorder, frequently misdiagnosed. But with the adults, they are already like, they've got their label, and they've been through different treatments and things. So what we would say, and I believe we say it in the book, is that combining is the most effective thing to do, because I'm sure you know that there is always something at the root, and it's very hard to get there. But when we have practiced with the neurofeedback and the biofeedback, people have gotten well enough to start exploring further into areas that before they had, the sympathetic nervous system telling them, do not go there. But now you start to open some more doors. And, our own experience with our own kids also was very enlightening to us, because we thought, he's a neuropsychologist and I'm a nurse. We should be able to do everything.
Right.
And do
We
it
got
all
this
right.
wired.
Exactly. But we were stymied, multiple times. But watching the kids when they did the neurofeedback and the biofeedback, which they were able to do in the elementary school years, and just watching things that were barriers to them kind of just crumble down in front of their way. And now even as adults, like we laugh sometimes, like, look at that. Like, remember when we were working on that or whatever, but like, we were doing the things that nurses and psychologists do, and we were ramming our heads against walls. And then this was like unlocking a code, and letting their own system, the way it was made, function in its own way. It was we are conventionally trained in nursing and psychology, and this was like outside of what we had been trained to see. So we were like excited, obviously, but also like mind-boggling, have to go into that space and see what's going on there.
And
Yeah.
I think I would add to that, towards the end of the book, second to last chapter, we give the stories of a social worker and a college therapist, university counselor, and they talk about how they started to integrate this in, not one or the other. And it was amazing, their story. After a couple years, the college counselor was like, my sessions are I need half as many sessions as I've ever needed. And then my sessions are actually so productive because they're not coming in running from a lion. They spent 8 minutes at the kiosk before they came in, got their nervous system regulated. Now they come in and they're ready to go. They're ready to explore. And then the social worker in these elementary schools that we talk about, she'd been doing this for 21 years for behavioral disorder kids. And she said, I started to do the breathing first. Then everything else happened so easy to the point now I just do the breathing with these kids because it changes the stomach pain, the anxiety attacks, those kind of things. So it's not a one or the other. It's, could we be, if we see the mass of people, could there be things that are doing that we call priming, that it's priming them to now take these excellent resources we have out there and use those correctly, not kind of be oil and water, but actually it can adhere to them, and our really good therapists out there can actually do their job more efficiently.
I love it. Once again, the book is called Tsunami, Building Resilience Against Anxiety and Depression. Dr. Timothy Royer and Amy Royer. Folks, how do people learn more about what you're doing and reach out and contact you?
Yeah.
What's the best way?
You can get a hold of us through RoyerNeuroscience.com or Doc at RoyerNeuroscience.com or Amy at RoyerNeuroscience.com.
Okay.
Yeah.
We'll have those linked up here at the show notes page
Sure.
at thetraumatherapistpodcast.com. Both of you, so inspiring. Love it. Love to have you back at a later date.
Sure.
And we'll be in touch.
Thank you.
Thanks, guys.
All right.
This
take
was
care.
awesome. Yeah.
Awesome. Appreciate it.